Hello lovelies! I wanted to create a sweet little video for you all on sacred, holistic, empowered headache care and how I approach it from that perspective, especially for chronic headaches and migraines, because I've been finding that that's a really big issue for a lot of my clients and a lot of my friends and family. So this will just be an introduction. I'm actually creating a whole course, a comprehensive course and play shop or workshop around chronic headache and migraine relief. But this short video will give you an introduction to some of my favorite techniques and the ones that I use to keep my head pain-free and to minimize headaches. I personally have dealt with headaches quite frequently over the last 15 years, I would say, since I started graduate school and was really busy homeschooling and raising my kids, just kind of a whirlwind through life. Had a lot of chronic pain and tension build up in my body, and so I have developed a lot of practices that are really effective even with busy lives. Taken a lot of wisdom from all of the trainings that I've done, used it on myself, used it on clients, used it on friends and family to make sure that not only does it work, but that it's actually easy to use and that we can integrate it into our daily routine. So when I do feel a headache coming on, I usually stop as soon as possible, and I will get into a resting pose, often a side-lying pose with some support under my head, just to see if doing some deep breathing and getting some rest will help to relieve that tension. If you can't take a break, if you're stuck, at the office, or you have to just keep going, taking care of kids, or whatever the reason, there are lots of things that we can actually do to break that pain cycle. I will show you at the end of the video what I would do if there was a pretty big headache flare-up. But if you're just feeling a little bit of chronic tension or just kind of need to get through the day, this is what I would do. So the first thing I would do is check my posture. If I'm standing, seated, whatever, I'm going to check where my body is in relation to my hips. And with the hips, we want to usually drop the tailbone and open up the low back so that we are sitting a little bit more on the back part of our pelvis versus the front. And this is going to open up space for the spine, but also when we're doing this, we're going to gently contract our abdominal muscles all the way around in a girdle. And this is going to gently engage our core muscles. When we lift those up, that lifting energy can really benefit all the way up the spine. There are some really amazing ways to make sure that our spine is aligned, especially if we can't get to the chiropractor, whether it's quarantine or we're just too busy. So I'll be going over those in another video where I talk about posture and movement, functional movement, and really how to use various practices to keep our spine in alignment. But for now, the things that I could probably recommend for most people are primal movements, so rocking, shaking, and bouncing to get that wave of relaxation up the spine, and postural release. And so I have videos on both of those if you're interested. I will be doing more classes and play shops around them, but I've got lots of videos right now, so if you need access, just let me know. So once I have released tension as much as possible from the hips up, I'm going to work directly on the chest, neck, and head. And so how I do that is primarily touch-based. Positional release is great for these chunky muscles at the top. It's a great way to start the process. But what I found most effective is really getting in there and just working out that tension. And it can be gentle. It doesn't have to be painful. These muscles at the top, the trapezius muscles, they run in a diamond shape from the base of the skull out to our shoulders and then down to our middle spine. We tend to have the most issues, especially if we have chronic headaches, with the muscles at the top, the upper trapezius. And especially as women, you know, because we tend to have chests that round us forward, we're often pushing past our comfort level or past our body's comfort level, which creates a lot of tension through here. The other thing that can affect this is the state of our digestive system and our liver and gallbladder. In women, our liver is often congested because it's so busy dealing with processing hormones from our body, but also synthetic hormones from our environment, from birth control pills, things like that. And then the gallbladder is affected in turn. And when our liver and gallbladder are affected, they tend to go more towards inflammation. And as we know from physics, inflammation causes heat, which rises, right? So rising heat can actually dry out the tissues in our upper body. It can dry out these tissues. And that heat can also affect our head. So we can get inflammation in our head. It can dry out the tissues, so our circulation isn't good, either up or down. We can get a lot of pressure built in our head, or the opposite, we can have a lack of circulation causing poor nutrition to our brain and to our head. The other thing that can happen when we have that heat rising, if we have excess mucus in our system, which is evident often when we have seasonal allergies or kind of that constant coughing up of mucus or just poor digestion, the heat can actually distill that mucus. It can basically cook it down, and it can create sticky deposits throughout our circulatory system, but also up in our head and into our head. And this can cause things like dementia. It can cause things like poor memory. It can cause just a sense of cloudiness. And so we want to do our best to break through this so we get functional and feel really good about our lives. Not only our body, but our lives as well. So with touch on these muscles, what I like to do is use my two first fingers and my thumb. And so we're doing a pinch or a pinch and a roll. And I'm going to turn around so you can see. So I'm pinching and rolling, especially under this chunky muscle here. And it usually feels pretty good. You can move around with it if you like. If you feel like that you want to stretch, you can go ahead and stretch gently. You can also press into your head, into your hand, and see if anything shifts. We don't want to use force with this. This isn't chiropractic. We're just creating a resistance as we lengthen. Doing gentle neck movements is great, but really what I found is that pinching and rolling motion all the way up to the base of the skull and getting in there and doing some acupressure can really be beneficial. And we can do a rolling motion with our thumbs all the way from the middle out to behind our ears. And when we do that whole area, as we get out more towards our ears, there's this tender spot that can actually support insomnia. It can support healthy sleep patterns. And so it's great to do this regularly, especially before bed, but also just throughout the day. We also want to pay attention to the posture of our neck. So often we'll have chins forward. These guys are kind of stretched out and weak. These guys are all weak. We want our neck retracted gently, our chin retracted gently without it being forced. And so when our spine is balanced all the way from our hips up, that naturally tends to happen. But you might need to check yourself, right? So it can be helpful to have a mirror close by your desk or wherever you tend to be in that type of posture, just to check yourself. I'd say every couple hours at least can be a good time for a posture check. Also a good time for a stretch or a little rubby. Get in there and kind of squeeze everything around. Do some neck rolls, do some head turns. We can pinch these little guys at the front. Often what happens when our muscles are irritable is we'll get knots or trigger points, which can put pressure on the nerves that run through, and that will cause radiating pain up into our head. So headaches can actually be caused not only by pressure in the head, that's more common in migraines, but tension and knots in the muscles of our neck. So gentle pinching for these guys. We don't want to push too hard in the area from these muscles forward, but we can definitely do gentle pinching and rolling of the skin. And this will not only help with our circulation, but it will help to build the collagen in this area, in our skin and in the connective tissue that runs through it. Often when we age, our connective tissue gets really dysfunctional. We have a poor production or lowered production of collagen, and so it will start to sag. It will lose its resiliency. As it loses its resiliency, we might get a buildup of scar tissue as our bodies attempt to try and support it. And this is common in the throat if we have a chronic case of not being able to speak our voice or of holding back our expression. So if that's the case for you, you might really benefit from getting in there and just doing gentle pinching and rolling. You can tone while you're doing it if it feels good. You can breathe, or you can just gently pinch. Breathing is also a great way to support headache relief, because it is helping to create space in the chest for fluids to move into. Any pressure that's built up in the head and neck, if we are opening, it's going to essentially pump it out. When we get into that state of flow, that state of connecting with the breath, we tend to be able to expand and contract with ease, or with more ease than if we were holding our breath. And with chronic pain, we are often stuck in either an in-breath or an out-breath. We're not doing a full inhalation and exhalation, and we might not be doing a full one of either of those. And this can be a very overwhelming and anxious-ridden place to be. We can feel stuck, we can feel lost, or we can just feel like we're not comfortable in our bodies. So it's all about getting back into our bodies, learning how to move them effectively so that everything can flow. Our fluids can move, our energy can move, our muscles can move like they're supposed to, like they want to. And we're just giving them the support they need to make that happen. So another thing that I really like to do for chronic neck pain causing headaches, let me see here, is to use my cups. And I have a wide range of cups. I have a cupping course available right now if you're curious about how it all works, but I'll just give you a quick demo. So these are just basic silicone cups that you can get on Amazon for pretty cheap. And I'm just popping it on. It's kind of tricky to get the neck. Let's see if I can get this on. If not, I'll use my other guy. So I have lots of these guys. I have silicone cups, I have hard plastic cups with a vacuum pump, I have glass cups that we use fire with, but these I found are amazing. You can just carry them around with you, have them sitting at your desk, have them scattered throughout your house, put them in your purse, whatever you need. So I just put this on and let it sit. The other thing that I can do with it is to get a little bit of oil. So I just have a little oil. I'm dispersing it throughout my hands so it's not too greasy, and just put it on your neck. Now obviously if you're wearing nice clothes, you want to be cautious. You could take the shoulders down or just go topless if you need, but just really work that all in. Just a nice light coating. And then you can slide this cup all around. And again, you want to be cautious not to go in front of these little chunky muscles that pop out when you turn your head. But you can use it on the chest. Don't want to use it on the breast tissue. It's actually, there are some special applications for the breast, but in general, you want to stay off the breast tissue. And see how red this is in here? So this is a sign that I have some inflammation in my chest. And you can confirm that by looking at the tip of your tongue. If the tip of your tongue is red, then it's likely that you have some heat building up, likely from the digestive tract, possibly just from congestion in the heart or lungs. But we want to do our best to clear that. So working with cupping is great. You can also work with a tool like a blade or a blaster. And I think all my blades are put away for now. But a blade is just a flat piece of jade or rose quartz or bone, there's a lot of other potential things that they could be made of, materials that they could be made out of, but those are the most common. And they have rounded edges so that we can gently scrape over the tissue. This will help to break down any of that connective scar tissue that I was talking about that our body lays down when there's weakness or when it perceives weakness. But this tool I really enjoy. This is called a face blaster. You can get it in different forms. This is the little one that we use for the face, that we use for small areas. And so you can just get in and kind of scrub the areas that are especially tight. And it's great for building circulation. It's also great for helping to break down that excessive connective tissue that's built up. So it tends to feel really good. And I'm just going gently, finding those areas where there's soreness, there's tenderness, it feels really tight. I used my pinching and rolling to kind of assess. And one of the things that's really important to note with that, and that I talk about a lot, is that as we're assessing with our fingers, it's also a treatment. You know, we're also getting a therapeutic effect, but we can really check on the condition of our connective tissue. And that we notice that by, if we can pick up the skin over an area, then it's likely that there's not too much connective tissue binding it down. But if it all comes up in a big chunk, and we're pinching up muscle tissue and skin, and it's just a big chunk, then it's likely that there's some scar tissue buildup there. And that can be common even if there's no injury. It can be common with repetitive injuries or just overuse, okay? So I'm just going in, and I just do this for a couple minutes. Really helps to drain any excess fluids. Going back and forth across the muscle as well as up and down. And it feels really good. So I've got it in a lot of color, feeling pretty good. And then at that point you can get into the head. So sometimes headaches will be from jaw tension. And so working on these muscles, the masseter muscle, which runs like this from our cheekbone to our jaw, can be really beneficial. We also have little tiny muscles called the pterygoids that are underneath that, kind of like a little pyramid. So those can hold a lot of tension. We can have sinus issues. Sinus issues respond well to acupressure. So there's different points on the body we can use, and I'll put out a little infographic about that. But really the things that I found best for sinus congestion, or chronic sinus congestion causing headaches, is herbal care. Herbal care and looking at our nutrition. So doing all of these things, but really making sure to get all of the aspects of our body that can affect it, especially our mucus production and inflammation. So we talked about posture and how we move. We talked about primal movements and positional release to help with deep tension. We talked about using our hands to roll and pinch and assess the state of the connective tissue and the muscle tissue. We talked about different types of touch, so using acupressure at the base of the skull, using gentle stretching and head and neck rolling, making sure that our chin isn't jutting too far forward. And then we talked about cupping and blasting to really help break down any scar tissue buildup so that we can get proper movement, so that we can get proper circulation. Okay, so those are some of the things that I personally go to whenever I'm starting to feel a headache building up, or as prevention. And honestly, I do most of these things at least for a couple minutes every day, and oftentimes while I'm working. So, you know, if I'm typing at the computer, when I'm taking a break to think about what words I'm going to type, I'll be kind of absent-mindedly working in this area. When I'm, relaxing, I might actually do a little more focused care. So I'm getting in throughout the day, maybe like 15 minutes regularly, and more if I need more care. So it is really possible to integrate it into your day. I'm a busy mom. I have 3 kids. I have my own business, and I'm a single mom. And so really I can say with certainty that you can integrate these into your life. So I will be, like I said, doing a more intensive play shop, as well as having a self-paced course around working with headache relief, holistic headache relief, sacred headache relief, empowered headache relief on multiple levels. So working with the digestion, working with herbal care, working with touch, working with movement, doing all of these things that really add up to not only a pain-free body or a pain-minimized body, but a body that's able to shift into pleasure. Because when we are really able to contract and relax our muscles effectively, when we have a smooth, even sheet of connective tissue, that's where it's supposed to be. When we have proper circulation of blood and deeply nourished body parts, we can begin to shift into orgasmic health. And the amazing thing is we can use any tension that's built up as pleasure potential. So if we have tension built up in these suboccipital muscles, we can learn to rhythmically pulse them to stimulate an orgasmic response. And the more areas of our body that are really functional, the easier it will be to stimulate that response. When we have clear functional muscles all the way from our skull down to our hips, we can actually train our bodies to initiate an orgasmic cascade, which is an orgasmic response somewhere in the body that runs all the way down through the nervous system to the pelvis. And so we can stimulate a full body orgasmic response without even needing to give any attention to the pelvis, any attention to the genitals, unless we want to, which can definitely amplify it. But we can have an orgasmic release where we are releasing deep tension in a way that feels very pleasurable. And we can do that anywhere in the body if we are devoted to it, if we are consistent in our practice. Okay, so I'm going to talk all about more of that in future videos, but I just wanted to plant the seed for you to know that it's not only possible to shift out of pain, but to use these techniques to really shift into deep pleasure and have that be part of our daily routine. Okay, let me know if you have any questions. I'm happy to go deeper into anything, but really I think if you do have chronic headaches, you need to either take this Play Shop, get the course, or contact me for a one-on-one consultation, which at this point, my initial assessments are free, and all of my sessions are sliding scale right now, so there's no reason, don't let finances hold you back. I'm here for you. I want to help you shift out of pain. Okay, I love you, and I will talk to you soon.